Today we are discussing a very important topic, namely arthritis. Arthritis is a loose term and everyone tends to use the term arthritis whenever there is pain in a joint. But what is arthritis? The term arthritis indicates the joint is inflamed, meaning thereby there is redness, there is warmth and pain on touching, loss of function. All these components, swelling, is called arthritis. So it is due to inflammation of a joint, and it can affect any joint of the body. There are ever so many joints of the body, small, large, upper limb, lower limb, trunk, everywhere there are joints. Who will get arthritis? Am I a candidate? People of any age can be affected. Children can have arthritis, youngsters can have arthritis, middle-aged people can have arthritis. It increases as age advances because of degenerative changes. Males and females, respective sex, anybody can have arthritis. What are the common symptoms of arthritis? Pain, pain, pain. That's the most important reason for arthritis. But remember, pain in a joint does not mean it's arthritis. Pain can occur because of many reasons. Somebody with heart attack may complain of pain in the shoulder. Somebody with pleurisy may complain of pain in the shoulder. Somebody with a disc prolapse in the neck may complain of pain in a joint. So, pain in a joint does not mean arthritis. To say arthritis, we must have swelling, redness, inability to move a joint. It can be properly treated. If not, the severity of symptoms may increase. It can make you disabled or even bedbound. That was what was happening decades ago when most of our patients with arthritis were bedbound after a few years. Things have changed now. People get better with the current line of treatment, and that makes us very hopeful that in the near future arthritis can be completely cured. What causes arthritis? That's a very difficult question. Majority of the time, the cause of arthritis is not known. The cause remains unknown. But sometimes it is known also. Joints can get infected by itself, or it can be infection elsewhere in the body. A reaction may take place in the joint, reactive arthritis. It may be deficiencies related to nutrition. It may be age-related wear and tear. It can be disease of any other system that can produce arthritis. People with skin diseases like psoriasis, leprosy, disease of the intestines, urinary system, or allergy-related or autoimmune diseases can have arthritis. But always the causes are not known. It can run in families as a genetically transmitted disease, but almost always the cause may be unknown. What are the symptoms of arthritis? And I have numbness in my fingers, in my leg. Am I having arthritis? This is a question commonly patients ask. Symptoms of numbness, tingling, are pointing towards nerves as the site of disease, not joints. So arthritis will not come as tingling, numbness or paresthesia. Arthritis produces definite pain, but not numbness. Sometimes patients complain is only sounds coming from the joint. Clicking sounds, cracking sounds from the joint. Is it sign of disease? No, it is not. Then why there are sounds coming from the joints? Whenever two bones are moving and they rub against each other and the surfaces are very rough, you may get a rubbing sound. There are some cords that connects the bones so that it becomes stable, and the movements of these cords, coir-like substances in and around joints, can make sounds. Similarly, there are muscles. At the end of the muscles are what's called tendons, and they can also slip over a joint and can produce funny sounds. Sounds from the neck, very common. Sound from the knee joint, very common. Sound from any small joints, fingers, very, very common. So joints are not a symptom of arthritis. Then what are symptoms of arthritis? Yes, morning stiffness, meaning thereby patient wakes up in the morning, cannot move, very severe pain. By lunchtime they're okay. Back in the evening, night, again pain appears. This is a very specific symptom of arthritis patients called morning stiffness. And the fluctuation between day and night is very, very striking. Also, the patient will complain of swelling, pain, and they will say there is fever in the joint. That means joint is inflamed and warm. And sometimes fair skinned people, it may appear red. Even in brown skinned people, redness may be seen sometimes. That too in certain types of arthritis, redness is a very important thing. What are the common causes of arthritis? Exact cause of arthritis is still not known. There are 150 different types of arthritis. Sometimes you can easily find out the cause for arthritis, sometimes not. Someone with TB, someone with leprosy, we can say this is the cause. But that's not the case always. And there may be some genetic predisposition for a particular individual, and when he is exposed to a particular environment like smoking, he gets into trouble and he gets arthritis. So a human being may have genetic predisposition, his body habitus may have some predisposition, and a particular environment interaction, some infection precipitates arthritis. Arthritis is not anybody's fault. It is not our fault. How do you diagnose arthritis? Basically, it's a diagnosis based upon what you tell the doctor and what doctor understands and what he finds out by examining you. In other words, arthritis is something that a doctor can make out by interacting with the patient and not by blood test alone. If you depend on blood test investigation to make arthritis, you are likely to go wrong. Always present your symptoms to the doctor and let him examine you, and he'll come to conclusion what exactly is the problem. He will go to minute details. What duration of your illness? At what age you had the first episode? Is it a continuous type of arthritis or coming and going off and on? Episodic type. Is it associated with other skin diseases? Disease of the eyes, mouth, throat, chest, heart, intestines, kidneys, infections, as HIV, leprosy, and so on and so forth. Even hair fall may be a clue. Simple ulcers coming in the mouth often may be a sign. Simple itching in the skin, some rash over here and there, some nodules coming here and there, some lumps and bumps, all are relevant as far as doctor is concerned. So what are the lab tests available for diagnosing arthritis? Ever so many tests are available, but it is prudent not to go for lab investigation. Do the test the doctor orders, not everything under the sun. There may be tests on the blood, x-rays, scans of different types, maybe ultrasound, maybe Doppler studies, maybe CT scan, MRI, PET scan, whatnot, nuclear scans, genetic test, aspiration of fluid from joints. All tests are not required for everyone. So you make a provisional impression what type of arthritis you are having. Based upon that you proceed with the investigation. You cannot order investigation for 150 different types of arthritis. You have to shortlist 3-4 and then proceed. So doctor has to make the decision what type of arthritis is likely to be, and then he will proceed with the investigation. And who will treat arthritis? It is desirable that treatment start with modern medicine. Any doctor with a MBBS degree can treat arthritis. You need not run after a specialist. The MD man can easily do the job, qualified physician. If these people find difficult to control arthritis or find difficult to make a diagnosis, obviously he will refer you to a rheumatologist. You can take his services as well. And the rheumatologist may in turn tell, I will prescribe medications, but you also meet physiotherapist, and the complementary treatment of the doctor and the physiotherapist will be the best treatment for the patient. Some patients will stick on the physiotherapist without following medications, and some people follow medications refusing to go to physiotherapist. It's prudent to take the help of physiotherapist while continuing the drugs prescribed by the doctor, and that's the best option for the patient. Physiotherapy in turn can reduce pain, reduce swelling, reduces inflammation, and makes the muscles stronger, so they will be able to perform as before as they get well. What are the causes of arthritis? So already we have discussed 150 different of arthritis. Majority of the time the causes are not known, but you will get some clue by looking at which are joints are affected. The pain in a joint need not necessarily mean it is coming from a joint or you are having arthritis. The pain may come from bones, cartilage, ligaments, capsule, synovia. The arthritis may be confined to very small joints of fingers, very large joints like your knees, ankles, shoulders, wrist. It may be symmetrical on both sides. It may be confined to lower limb alone, or it may be confined to your spine alone. Different patterns are there. Some come and go, some continues, some are symmetrical on both sides, some are asymmetrical. So all these combinations will again be a clue to type of arthritis you are talking about. And some of them can impair the function or produce deformities. So can you prevent arthritis? Well, some of the methods to avoid arthritis are available, but the majority of the cases we cannot prevent but can treat and relieve the symptoms. Example is arthritis commonly seen in females, sometimes also seen in males. If you talk to them, you will know they are all smokers. The smoking has done the trick. So if you can stop smoking or you prevent smoking in the community, maybe you can avoid it. Change the lifestyle maybe sometime be helpful. Human body cannot carry heavy weight. We are meant for only 70 kilograms. As it increases, it produces more strain, joints, and you get more wear and tear. Alcohol and tobacco are well known culprits. Dehydration may be cause. Lack of nutrition like vitamin D nutrition deficiency may also accelerate if at all there is arthritis. So some of the aspects can be prevented, some of them cannot be prevented. But even if you get arthritis, if you start treatment at the beginning, deformities can be avoided and you can be like a normal person. What are the common types of arthritis? The commonest, I will say, is osteoarthritis. It's a degeneration of the joints with the wear and tear. Now the question is, I have pain in my joint, is this arthritis? So it is better to look at the anatomy of the joint and surrounding structures, and this is how a joint look like. This is the knee joint of a person. You can see the bone above in the thigh is a femur, bones below is tibia and fibula. So the bones have got a blue colored substance there. It's a cartilage. It will be softer than bone. Obviously it makes the movement between them easier. And then these two bones are strongly connected to each other by a brown colored X-like structure in the middle, and that keeps the joint intact. The bones will not slip one from the other. And then you have two red colored things, cartilage, menisci, and they are like shock absorbers between the two joints. Then you find the green thing. It is a coir-like thing that binds the two bones together. So again, to avoid slipping or make this joint stable. They'll be flexible. At the same time, the joint will become stable. Now, outside the green, you find the last blue line. That's the capsule of the joint. And inside the capsule, a gray shade is there. That is a velvet-like structure called synovia. And inside the capsule, throughout, there is a fluid filling, bathing all these structures together, providing nutrition and lubrication and giving some softness for the joint and smooth function. just like oil in a hinge of a door. So this is the structure of a joint, and there are nerves coming to the joint from different structures to perceive pain. So whenever you have any injury to any part of this joint, a bone, white thing, blue, red, brown, green, gray, anywhere the problem, you get pain. So pain does not mean arthritis. Pain may be because of injury, it can produce severe pain, or the pain may be because of disease elsewhere that is referred to the joint, and you may think joint is the culprit. So pain in the joint is not indicative of arthritis. Pain in a joint is called arthralgia, and only when there are signs of inflammation like swelling, warmth, tenderness, redness, you call it as arthritis. So what's the treatment of arthritis? Obviously, patient's complaint is pain. Relieve the pain. If there are no contraindication, you can give painkillers. If there's swelling, you can give the drugs to reduce the swelling. There are specific drugs for different types of arthritis, and you will be advised as a complementary step physiotherapy and exercises. When all medications are tried and you don't get well, joints are badly damaged, irreparable, then surgery is the last option. How do you decide on the drugs? Well, depending upon the type of arthritis, stage of arthritis, the drugs are available, they differ, and for different types of arthritis, different types of drugs are used. Children, young adults, potentially pregnant people, already pregnant, lactating mothers, they all require special attention. When you prescribe medication for the old people, they are very careful about their kidneys, liver, diabetes, heart disease existing already. They can all interact each other and create problem. In other words, comorbid condition of the patient, other diseases and the drugs the patient already on will decide what type of drug the patient is to be given. Also the side effects, potential side effects or already existing side effects. Some of the drugs are costly, patient cannot buy. Some are not available. Some are producing side effects on the patient. So everything depends upon what type of situation you are facing. Accordingly, you have to go for different types of drugs. And when you have arthritis, do you apply heat? Usually, it is the ice that is kept to relieve the redness, warmth and tenderness. Sometimes heat is also advised, sometimes alternate heat and cold. Will you get arthritis in children? Yes, no age is exemption. No age is exempt. Any age can. People can have arthritis, young or old. Anybody can have arthritis. But there are specific diseases common for children, specific diseases common for old people, specific diseases for young females, middle-aged people, and so on. What about the weight of the patient? Human body is built such a way that we can have 70 kilograms average for a person, and joints can easily manage that. But as weight increases, the joints will find it difficult, they get wear and tear easily. Will arthritis affect heart? It's a very relevant question parents commonly ask. Some of the arthritis can affect the heart, but commonly it is rheumatic fever of children that produces problem for the heart. So it is possible but not very common. Next question is, will you get complete cure? Complete cure is possible for arthritis that's called acute arthritis, very short duration illness. Chronic diseases, complete cure may not be always be possible, but naturally sometimes there are remissions and the disease may die out. So by and large, acute arthritis may be treatable. Chikungunya, for example, patients get very well soon after onset of arthritis, but others may not be. So at the beginning itself, it is not possible to predict whether a complete cure is possible or not. Newer drugs have started appearing in the market, and the outcome is better than ever before, and still newer drugs will keep on coming, and hopefully we will be able to sort it out. When do you do surgery? Patients should not ask for surgery at any point of time. God-given joints are always superior and better than man-made joints. But if the drugs are all used, patient is not getting well, patients have severe pain and disabled, crippled, deformities are appearing, well, there are certain situations where joints can be replaced. They're expensive. Sometimes the surgery is not successful. Sometimes there will be complications following that. Sometimes you have to replace the joints thereafter. So surgery is something doctor will tell you and then only you do it. So far I was talking about arthritis. Now compared to yesteryears, arthritis is now easily treated. Newer drugs are available provided you approach doctor early in its onset. Commonly doctors meet this patient first time 5 years, 10 years after the onset of arthritis. By the time permanent damage has already taken place in the joint and doctor will have very limited options left over before him. But if you approach him within 2 months after the onset of the arthritis, he may be able to take care of you such a way that joints remains intact. Sometimes you will have to continue the medication, but you will be perfectly all right. So modern medicine currently is ready to treat different types of arthritis provided you approach them early. But if you go with all deformed joints, it may not be worthwhile. Now the policy is simple: catch arthritis early, treat early, and you get absolutely well. Now another situation is people want to try different systems of medications together, and I prefer that you remain in one system and continue to treat these patients. If you are opting for modern medicine, stick on to that, because when you use this medicine to other systems, there may be interactions of the drugs. Some of your organs like kidneys, liver may get damaged. We don't know what the contents of those medications are. So if you are going for modern medicine, we have newer modalities of treatment. You are likely to get well. Your joints will not get damaged, provided you approach them early and then you stick on to them and you will get well. Thank you.